Right, so good afternoon, Nimmi. Lovely to meet you again. Thank you so much for your time, so that we can spend on tonight's podcast. Been really looking forward to it. So I'm going to ask you, please, could you tell us, or could you start actually by telling our listeners a little bit about your background, and what specifically you're currently doing?
Yeah, my name's Nimmi, and I am a PhD researcher at the University College of London at the moment. And so my background is in health psychology, and I focus a lot of my research is focused on sort of health inequalities for people from minority ethnic groups. So the research that I'm currently focusing on is a project focusing on breast cancer and for Black women and South Asian women who are taking hormone therapy as a treatment for their breast cancer. So understanding their experience of it and why they may take it or may choose not to take it.
You very much. So, for clarity, how does hormone therapy, as a cancer treatment, typically differ from, say, chemotherapy, which many
Mm.
people are familiar with, in its effects on the body, or on the hair as well? We're going to talk about
Yeah.
hair later on. Is it more common to experience hair loss, thinning with hormone therapy and chemo?
Chemotherapy and hormone therapy work in different ways, and they're typically prescribed. Obviously, this is a generalization. People have different experiences, but typically they're prescribed at different times. Often chemotherapy is given first, and then hormone therapy is given as a treatment after, sort of whether it's surgery or chemo or radiotherapy or whatever treatment people have given. The way that they differ is that chemotherapy targets the dividing cells within the body. So it targets those cells which are dividing in the cancer. But the way it works is it will target all cells, so all that includes the healthy cells. And that's why a lot of people have a lot of side effects with the chemotherapy, including the hair loss. With hormone therapy, it's slightly different. What it does with the hormone therapy is it lowers or blocks particular hormones. So, for breast cancer, it's particularly estrogen. And the reason that it does this is there's certain types of breast cancer which are more affected by the estrogen. So, if you have a hormone receptor positive breast cancer, the presence of that estrogen in your body can cause the cancer to grow or to come back. So what the hormone therapy does is it blocks that estrogen. However, it can cause hair thinning or slow hair regrowth or cause hair loss because estrogen is involved in promoting hair growth in our body.
Really interesting. So, someone who may have chemotherapy treatment and their hair will be affected, and then they're going to have the hormone therapy. That's two lots
Yeah.
treatment that may well um, affect their hair.
Yeah, and some patients kind of experience is they experience that hair loss through the chemotherapy, and then the effect of the hormone therapy is it just reduces the regrowth or the sort of it stops the hair coming back, so it prevents that and that kind of extends that period of hair loss.
Okay, that's really interesting. I didn't know that. Thank you for
Mm.
sharing that. Um, and what types of cancer most commonly involve hormone therapy? So
Yeah.
you're talking about I know the work you're doing is breast cancer at the moment, but do you aware of any other types of
Yeah, I would say largely it's breast cancer, which is hormone therapy is used as a treatment, but also for prostate cancer, it's a different type of treatment, and that sort of um, is kind of to do with the level of testosterone in your body. Those are the two main ones that use hormone therapy. I think there are some cases of it being used in ovarian cancers, but maybe less frequently.
okay. And just having a think really about the biological process, you touched on it, which is really useful, really helpful to explain to people that are listening that don't quite know how it works. Um, how do these hormone blocking drugs impact the hair cycle? So I think you talked about thinning and
Mm.
um, I guess the regrowth. I think you just talked about it reduces um, the length of time it takes for the hair to recover. It slows that down. Is that right?
Yeah, so the way that it works, and this is a sort of more broad overview, but estrogen as a hormone tends to sort of protect the hair follicle and prolong that growth period. And so by blocking the estrogen, that then kind of removes that protection and it removes the effect that estrogen can have on that growth period of the hair. So yeah, that's something that that's kind of how it will affect the hair growth in that way. For prostate cancer, I'm less sure on the effect of how it will affect the hair growth because the effect of testosterone is slightly different in the way that it works on hair thinning.
Interesting. In terms of the certain classes of hormone therapy drugs, are there any particular ones that will impact hair more than others, or
Yeah,
that
and
you
I
can
think
name?
this is something that's still being researched, but it kind of depends on which type of, there's different types of hormone therapy. So
Mm.
if I just focus on breast cancer here, because that's probably where my expertise is. Um, but I think in terms of the different types of uh, treatment. So the two main types of hormone therapy that you have are tamoxifen and the aromatase inhibitors. And those include things like letrozole or exemestane that people might be familiar with. And so what the way tamoxifen works is it blocks the estrogen receptors. So the estrogen is still there, but it blocks the thing that attaches to the estrogen in order to create that cell growth for the cancer recurrence. And that means that there's sort of estrogen blockage within the body, but there is still activity of estrogen there. Whereas with aromatase inhibitors, it stops the body from producing the estrogen, um, and by blocking the thing that creates the estrogen in the body. And so that leads to much lower levels. And therefore, sometimes people will see more cases of hair thinning with the aromatase inhibitors um, compared to the tamoxifen. I would say that with both cases, generally it is obviously this is some people have more extreme cases, but generally the hair thinning and loss is relatively mild, but it can still sort of impact people's experiences, particularly as these are treatments that are prescribed for between 5 and 10 years and sometimes indefinitely. So, while the effect might be mild, it still is there for a very long time.
And how is the hormone treatment? How is it given? Is it medication? Is it
Yeah, so
injected?
it's typically taken as a tablet, which is taken once a day, for that length of time that you've been prescribed, so between 5 and 10 years.
Okay. And what do you think the biggest knowledge gap? I know you're doing some research at the moment, but what is the biggest knowledge gap in this specific area at this time? And what is it that your current research is trying to understand or to solve?
Yeah, so I think that's a really good question. So what I'm trying to research at the moment is understanding uh, Black women's and South Asian women's experiences with taking the hormone therapy. So there's research from the US which suggests that Black women are less likely to take their hormone therapy as prescribed um, compared to white women. And there's sort of preliminary research from the UK which suggests a similar pattern that women from minority ethnic groups are less likely to continue to take their hormone therapy. So what I'm trying to do at the moment is understand what women's experiences are with taking it, how the side effects affect their life, what they believe about their medications and why they might be likely to not take it, and understanding how we can better support them, because I think that's the key aim of a lot of research that's happening. Is I think, as I said, a lot of what I do is focusing on sort of health inequalities for minority ethnic groups, and I think we're moving towards a space, or trying to move towards a space within the healthcare system of wanting people to have equal care, or to have care that supports them in the ways that they need. And in terms of the hair loss, I think something that I am interested in, and I don't know if how much there's been sort of researched about this so far, is I think it hasn't always been considered as the biggest side effect of hormone therapy, because as I said, the effects are typically quite mild. However, I think, having spoken to many women over the time that I've been doing the research, hair has a big role in identity. And I think, as the hormone therapy is often prescribed after chemo, after surgery, and women are kind of trying to get back to their lives or return to a sense of normalcy, that can be a big sort of, um, it's an important thing, it can be an important thing in getting back to feeling like themselves. Um, so yeah, it's something that I'm very interested in. I don't have any answers so far, but I think it's something that's really important to discuss, with people, because if we're trying to improve people's qualities of life, that can be a very big role in it.
Absolutely. And do you know if they're told about the effect on hair
Mm.
before they start the treatment?
Yeah, and again, so I think this is something that I found has been very varied in the people that I've spoken to, I think, and the research that's been done. It seems like it's a very uh lots of people have very different experiences with how much they're told. Generally, a lot of people I've spoken to haven't really been prepared for the side effects and, hair loss as um, a potential side effect of the hormone therapy. And I think that may be quite difficult because, if it's not something that you're anticipating, or if it's not hair loss, but you've lost your hair through the process of chemo and you're expecting regrowth and you don't see that happening, um, that can be quite a challenging thing. So I think potentially more could be done to sort of make people aware that these are potential side effects.
Definitely. And I think you talked about the emotional side. So beyond the physical aspect of losing hair, what's the emotional and psychological toll um of the hair loss or hair thinning? What do you think? What have they said? And in terms of what kinds of I think you just actually touched on it in terms of the support that they would need. They need to be told in advance. That would
Yeah.
help, wouldn't it, to prepare women? So have they shared, or would you know what the psychological impacts?
Yeah. Again, I think it is something that's very different for different people, but I think, um, it can be a difficult thing to manage, particularly as it's very usually not the only side effect that you're experiencing from the hormone therapy. So,
Yeah,
right, if you're experiencing some of the slightly more common side effects such as joint pains or hot flushes or the fatigue, and then on top of that you have this hair thinning, or your the like lack of regrowth, it can be something that is, you know, quite difficult for people. I think currently with the research, it's not been cited as a main reason why people stop taking it. Um, but I think there needs to be more, or I would like to see more research done kind of into the impact and that psychological impact on people, because I think it's not something that's been discussed as much.
definitely. And what one is there a key message? What one key message would you wish every oncologist would share with their patient about hormone therapy?
Yeah, I think, one thing that I think is important is trying to address this divide of what's important to the patient versus the oncologist. So something like hair thinning may not be considered as as much of a priority to your healthcare team, because obviously they are focused on reducing the risk of recurrence. But as we've discussed, for some women, this can be a very important thing. And so I think it goes back to that awareness. I think just kind of making people aware that this might be a potential, taking those sort of concerns seriously if they are raised, in terms of, I'm not seeing any hair growth back. What can I do to improve this? And sort of providing support. I think that would be something that would be very valuable, so that people are aware going in that, they're not kind of taken by surprise by this.
Excellent. And if you could leave our listeners with one core takeaway, a message of maybe hope, caution, or maybe just essential advice,
Mm.
what would that be?
Yeah, I think one thing I would like to highlight is that I don't want this to be something that people fear, because with the hormone therapy, people's experiences are very different, and the way that your hormones affect your body from person to person can vary massively. And so, you know, it's not to say that everyone will experience all of the side effects, including hair thinning that I've mentioned. And I think the thing I'd like to leave people with is that, it's not something that you have to suffer with alone. If hair thinning or hair loss is something that is affecting you, there is support out there, and there's loads of amazing charities. And obviously, a lot of my research focuses on women from um, Black and South Asian backgrounds, and I think um, there's amazing charities who are doing great things, who will be there to support and help you advocate to your healthcare team if that's something that you need.
Mhm. And for those listeners, because you're doing some fabulous research, so well done. It's really interesting. If anybody wants to follow your work or see the outcome of your research study, how can we find you? How can they find you?
Yeah. Yeah, actually, I guess this kind of relates to that message. So something that I'd like to say is that I think um, there is slowly more research being done into uh, minority ethnic people's experiences in the healthcare system and with cancer and with breast cancer. But I think there is sometimes a hesitance about taking part in research, and which is completely understandable. And I think lots of people have valid concerns about it. But one way to improve patient experience for sort of minority ethnic groups is to take part in these research, so that we're aware what the issues are and how we can move forward and how we can better support people. So that's what my project is aiming to do. We're doing interviews with Black women, and some interviews with South Asian women, and we also have a questionnaire study, and that will sort of culminate in doing workshops at the end once we have the sort of findings and results, where we'll discuss these findings with patients, with charities, and with healthcare professionals to kind of discuss um, these are the things that we found. What can we now do to actually improve things and to improve support for um, minority ethnic women? So I think, yeah, if anyone would like to take part, I have my email address, which is sop.reform, REFORM, at ucl.ac.uk. And we also have social media pages, which is reform_transform.
Brilliant. I can tag those in when this
Yeah.
goes live. So when do you expect to finish? When's your sort of deadline?
Yeah, so we'll be running those workshops that I mentioned towards the end of 2026. And so, yeah, once we've done those, we'll kind of write everything up, and we'll be sharing the results with people wider. So the research is ongoing during that time. So
Excellent. Oh, look, very well done. It's been really interesting talking to you. It's just great to know that there's so many, d different projects, different initiatives going on almost for us behind the scene. You're bringing it to the forefront so people can, get involved and ask those questions, and certainly be a part of shaping the future. Because you've explained it, if you don't hear from the individual women who are experiencing it, then they can't improve their own outcome and those of other people as well that will come. Perfect. So look, thanks so much for your time, Nimmi, and wishing you all the very, very best with your research. And I cannot wait to read it. Well done. Thanks so
Thank you so
much.
much. Thank
Thank
you.
you, Kate. Goodbye. Thank
Bye.
you. Bye-bye.